Good morning. It's Saturday, April 11th. Welcome to The Doctor's In, Ask Dr. Arwady. We're so glad that you're with us. I am Sybil Madison, the Deputy Mayor for Education and Human Services, and I'm here with Dr. Allison Arwady, who is our Commissioner for Chicago Department of Public Health. If you want to ask us questions, ask Dr. Arwady questions actually, put your comments or questions in the box below, or you can send them via Facebook or Twitter using the hashtag AskDrArwady. Let's check our social distance.
We're good?
We are good.
Most important.
Most important. And let's start it off with an update on COVID-19 here in Chicago.
All right, good morning everybody. So as always, if you go to chicago.gov/coronavirus, we've been making a lot of updates to the website, so take a look if you haven't recently. And right up at the top under latest data, you'll always find all the latest data. Lots of information about here. Every day we're adding more. There's links to articles if CDPH has been authors on scientific articles. There's all of our prior reports are also up there. People have been asking for that. And then actually on our data portal, which is where we sort of make data available, we're also working to make sure that the raw data is there for people who are interested in looking at it in different ways. So we're really doing what we can to try to make this accessible. There's going to be additional information up there, I think, about some of our ICU rates. And anyway, more coming. Keep an eye on the website. But as of now, we stand at 7,278 lab-confirmed cases of COVID-19 in Chicago residents, as well as, unfortunately, 212 deaths among Chicago residents. And that was an increase of about 659 cases and 16 deaths since the prior day. We've talked about that, unfortunately, deaths lag a little bit in terms of the data because it's very unusual for someone to die suddenly. Usually this is something where somebody's been infected and they've been in the hospital for a while, they've been in the ICU, and so we do really expect to continue, unfortunately, to see some rise in deaths there, and really thinking a lot about every time we talk about these numbers, but these do represent individuals and their families, and I think especially it's just hard. I will say that we are seeing some relative good news, both in terms of some of the flattening, which we've been talking about, and we continue to see improvements there. I told you next week I think we're going to have some more specifics and be able to show you some data more around that. But the most important thing, really, that drives our data, drives our biggest campaign here, that Stay Home, Save Lives, is about limiting any new infections, any opportunity that we have, especially in the month of April, to not have new infections is just so important. It's more important than anything else we do. And the main way to do that is to have all of you, as much as you can, not be interacting with people outside your household, to be staying at home where you can. When there are essential workers or you're needing to go out for essential reasons, you're being really careful about that social distancing, about the hand washing. If you are in the settings where you're not able to maybe maintain that social distancing, if you're in the grocery store or the pharmacy, wearing that cloth face covering, we've talked about that's not the most important thing, but it is part of, especially if people are not having symptoms and they're out, and it's possible, we know there are some percentage of people who can have very mild symptoms or even no symptoms. And again, that cloth face covering is really it's more about protecting your germs from getting out. It's not 100%, but it helps keep them from going further. It helps have some keeping that in there. So all of those pieces go together, but the basics of the hand washing, the not touching your eyes, nose, mouth, especially before, all of that really holds true. But I wanted to show, actually, it had been a few days since we'd showed our simulation with the dots moving around. And for people who maybe haven't been on, I know especially it's going to be Easter tomorrow. A lot of families typically would get together. My own family, we had about 31 people who were planned to get together, Easter services, etc. It is not a weekend, unfortunately, for doing that. For those who, started celebrating Passover and we're still in, not a time to get everybody together for Seder. It's a time for connecting virtually, and we'll talk more about that at the end. But I did want to show again this simulation if people haven't seen it or it's been a while. So let's pull it up, but not start it yet. So for those who haven't seen this, I'll just remind you, this is just a simulation of about 200 people, and we start with a situation where everybody is moving around per normal. Doing their normal business, out and about, not doing any, staying at home, as we might normally have. And what we're gonna see is that blue dots are healthy, uninfected people. And then as they're out interacting with each other, you quickly see that they're colliding with people who are infected, and then turning red as they themselves become infected, and then turning purple as they recover. And so let's go ahead and run the simulation, and we see really how quickly those blue dots turn to red and then turn to purple. But in a society where everybody's moving around, we just see very, very widespread and fast infection really spread through this simulation. And it's in a setting like that where we absolutely overwhelm our healthcare system. This is where you do see that rate of increase, just like we've talked about at the beginning, really spiking up, doubling every day or two, really not where we were kind of even though the numbers were low at the beginning, and why we've had to put these stay-at-home orders and the other things in place. Because then if we pull up the next simulation but don't start it yet, again we've got blue dots that are healthy, but we have 75% of people home. Staying put, not moving. We recognize that there are people, again, our essential workers who need to be out. We recognize there are essential reasons why people need to be, getting food or, getting medicine or going to the doctor. But at least 75% staying home. If we run this simulation in just a second, you're going to see that the blue dots, again, the ones that are moving may have contact, may become red as they become infected, and then again purple as they recover. But overall, it's much slower, and we see many fewer people getting infected. Yes. So let's go ahead and run that simulation. And again, we'll watch, as 75% of people stay home. So that's everybody who's not getting together with people outside their household. Overall, many fewer infections and a much slower rate. So just a good reminder, I think, again, as we're going into Easter tomorrow, which would for a lot of people be a time of gathering. Together. Exactly.
Across households. That this month especially is just not a time for doing that. So I think we've got that simulation up on the website. We've been working, even our bending the curve, our flattening the curve has some more animation on it. So take a look if you haven't. It's really the most important thing out of all the things that we're doing is limiting those interactions as much as we can, especially right now. I think in the rest of the data, there's nothing significantly different. I will note that Chicago cases are about 40% of the Illinois cases. They were half or more than half. And the Chicago... So another sign that the measures we put in place
have been working. Yeah, and the deaths in Chicago residents are about 35%, the deaths of what we're seeing across Illinois. Again, a sign of, where we were half, some improvements here, although a long way to go, and we do expect those deaths to continue to increase. Where we look at the deaths themselves, 120 of the 212 deaths are in people over 70. So that's 57% of the deaths in people over 70, even though in Chicago only 8% of our population is over 70. So really just highlighting again that risk for people who are older. 95% of our deaths remain in people with these underlying conditions. And again, those often will go along with people being older, but that's diabetes and cardiovascular disease, including hypertension, lung disease, other things that can put people at risk. We continue to see more men than women dying, about 61%, and we continue to see that race and ethnic disparities here, where 70% of our deaths are in the Black non-Latinx community. So we've talked about that a lot. Yesterday Candace Moore was here. Obviously, we'll continue to speak about that, but nothing significantly different in the data. But take a look online. All right.
And probably worth noting for those with underlying conditions, so important, especially for you to stay put and stay home, and to be really paying attention to yourself and symptoms that you might have, and reaching out to your doctor or seeking care if you're experiencing any symptoms.
Yeah, absolutely. And this is where, if there are people, we've been saying from the beginning, right, this has been a lot of the messaging, that those vulnerable populations, it's as true in Chicago as it is anywhere else. And then again, anybody who's, sick, even a little bit sick, not out, wearing some of that face covering if you have it even inside, thinking about how to have a lot of hand washing inside, and some of that surfaces, especially if you've got folks in the household who are in that vulnerable category. And we've talked a lot about this in prior days, but it's a lot of the most important messaging, so you'll hear us repeat it.
Okay, so let's take a look at questions.
Sounds good.
Paul Fine from Facebook. Does the course of the illness differ if one becomes infected by touching one's eyes or mouth versus inhaling the virus droplets into the lungs?
Okay, good question. So we've talked a little bit about this previously, but it doesn't really matter, we think, how it gets in. It's more about, as it gets in, the virus starts to replicate. It starts to copy itself, and as it copies itself in the respiratory tract, that's how then, when you are, coughing or sneezing or singing or loud talking or any of these things, that's how it sort of gets out and spreads. And the way that your body reacts to it, we think, is as much about your own underlying immunity, and we've talked a little bit about that in terms of and those underlying conditions in terms of how serious of a case you're likely to have if you do get infected. But there is some interesting research about how much virus you actually need to get infected, and that's another whole area of some research. So, if there's probably some thought that it's not like, you do probably need exposure to a certain amount to get infected, but that's an example of one of the questions that is still very much under review. And you need to do studies where you expose, animals is usually where you would start with this, really exposing sort of different amounts of exposure to virus to see how much of an exposure is necessarily needed. But at the end of the day, it doesn't really matter. It's mostly about once it's in and once you're infected, what your own body's immune response is.
Well, that's interesting.
Yeah.
Because I think a lot of us probably think someone sneezes and then boom, you've gotten it.
Yeah.
But it seems like it could be that the reason why the close contact is such an issue is because it's not just one incident, or
yeah,
I don't know.
I mean, there is one incident when you get infected, but whether and it is a higher risk if somebody sneezes right on you with a lot of droplets, et cetera, for sure. But it's more about how much of dose of something do you need to get infected, and it's not that that a very large exposure would make you, I think based on what we know, it's not so much that a lot got in, it's that if there's a certain amount that means you've been infected, you've then been infected, and it's much more about how the virus replicates in your own body, in your own immune system, and your response to that. So, so I wouldn't, in terms of what does this mean for day-to-day life, keeping that 6 foot of contact, keeping that 6 feet of distance, all of the hand washing. It's not that some are higher risk exposures than others, but any of them have the possibility for infection. And if you get infected, it doesn't matter if it came in through your eyes, your nose, your mouth, through this exposure, et cetera. At that point, once it's there, we've talked about there's nothing that you can, you can't try to steam it out of your body. You can't, we've heard a lot of these rumors about ways to try to get it out. If you've been infected, at that point, your immune system just needs to fight it off. And you having your chronic conditions in the best control that you can, be doing the things to be taking care of yourself and having a strong immune system, like getting enough sleep, like trying to manage stress. All of those things are important so that you're as healthy as you can be. But yeah, it's more about just if you've been infected, how your body responds to it.
Got it. Okay. Interesting. It's always nice to hear about the latest research.
Yeah.
Monique Shigoyle from Facebook. If you show no symptoms to COVID-19 but have the disease, How long are you contagious?
Oh, good question, Monique. So this is one of the things that has been an area of the most interest, I'd say, and the most research, where, again, there's been a recognition that although most people definitely, based on everything we know, get symptoms, there are people who have these just very mild type symptoms or can have no symptoms, even, kind of leading into during the time where they can be transmitting virus, and then later go on to develop symptoms. So what the recommendations are at this point, kind of based on what is known about this, is, for one thing, we now are considering when someone is it's a little bit of a different question, but I think it's important to understand. Say someone is diagnosed with coronavirus, like they have some symptoms and they've been diagnosed with coronavirus. We are now, as we're thinking about our recommendations and sort of for public health, we go back 2 days in advance of when they really developed symptoms, or were tested positive, in terms of recognizing that they may have had a couple of days of potential transmission, even in, we think, about 2 days before they develop symptoms. So that's been part of kind of in public health, one of the things that has changed as we've learned more about this virus. We think about, if someone says, this is the day where I really develop symptoms, we're more generally kind of thinking about 2 days before that, where we think about exposures. So that's one piece of it. For somebody who's just totally asymptomatic, we use the date that they were tested, because what else can you use?
Right.
There's not, we think, again, this is based on what we know, and there's ongoing research, there's not evidence that somebody who's been infected and asymptomatic would sort of have it for a very long time. Again, this is an ongoing piece of research, but it's more that they would still be expected to have a similar course of disease, but their immune system is such that they're just not mounting very much of a response. And so we see that especially in children, or younger, healthier people, who may have very little immune response. And so in that case, we use that same 7 days that we've talked about for everybody else. So if somebody has no symptoms at all, if they're diagnosed with a test, and again, some of this is about why are you getting tested, right? Like there remain concerns about testing people who are asymptomatic. Yeah, because a test does not tell you, you can definitely have false negatives. So you can have somebody who's been infected, and again, it can take up to 14 days, right, from the time you've been exposed till the time you're actually infected, and you can absolutely have false negatives, and there's some false positives there, depending on which kind of test is being used. So for somebody who's asymptomatic, we basically say from the date that you were tested, stay home for 7 days, just like if you think about, we say you have to stay home a minimum of 7 days, and at least 3 of those days need to be without fever, and with improving. So in that case, and it's whichever of those is longer. So in this case, it would be the 7 days from the test. But what I don't want people really doing is, if they've had some significant exposure or they're having some symptoms and that's the reason why they're being tested, they shouldn't be out and about kind of waiting for their test result, right? Like this is one of the things that can be complicated.
That is important.
Yeah, and so, I mean, for people who really have no symptoms, it's difficult because they don't have any reason to, to think that they've been infected. And that's, again, why the CDC went ahead and put that recommendation for the cloth face coverings, especially in settings where you can't maintain that 6 foot of distance. That is primarily about protecting people when you yourself are not having symptoms. If you're having symptoms,
you shouldn't be out.
Yeah, shouldn't be out, period, right? Period. But this sense that, at least in some percentage of people, having that face covering in settings where you can't maintain a social distance is about helping prevent the spread to others.
Got it. Letitia Johnson from Facebook. Once you've had coronavirus, can you catch it again?
Okay.
This has been in the news a little bit recently.
And we've talked about this a lot of days, but I know it's been one of the points of most interest. So the question about sort of catching it again or developing immunity, those are kind of two different ways of asking a similar question. So based again on what we know now, once somebody has had COVID-19, their body does develop some of these antibodies, right? And again, for those who maybe haven't been following along, the test, the most standard test, the PCR test, the test where you do a nose swab or a throat swab, is looking for active virus in your nose. The newer kind of test, the antibody test, which I want people to understand is not yet approved by the FDA, by the Food and Drug Administration. There's still a lot of work understanding it, and it's not meant to be used for clinical diagnosis. So where some of this serology, which is the blood test that looks for the immune response to coronavirus, that is still in sort of research settings, and it needs to be done. You can't just use that to diagnose someone. You need to pair it, right now anyway, with that nose test. And whether that's rapid or not, these are different, but the serology...
They tell us different things.
And they tell us different things. The idea of the serology, which is the blood test, that one definitely has more false positives and false negatives, based on what we know, than the PCR test. For example, say you've been exposed or previously had one of the other types of coronavirus, right? Like we've talked about.
This is a family.
It's a family. COVID-19 is just one type of that family, and there are other coronaviruses, including those that can cause the common cold. Some of those serology tests, those antibody tests, are not good at distinguishing between did you have COVID-19 or did you just have one of the other types of coronaviruses. Similarly, there are more false, that would be a false positive. Similarly, there are definitely more false negatives. But at a population level where you're wanting to really understand, have people had that immune response. In an ideal world, as testing improves, there's actually two different kinds of antibodies. There's one that's called IgM, immunoglobulin M. We're getting a little too technical here. But the first one really shows you sort of ideally, as the tests get better, you know, have you had a recent infection, right? Are you maybe like 5 or 6 days even into your infection? It doesn't show up though. That's an antibody response. It's not there right at the beginning when you're infected, like the PCR was. It takes some time for your body to have even that early antibody response. And so, but that one lets us know somebody is sort of,
that it happened recently.
It happened very recently, and so they would potentially still be in an infectious phase. And then there's another type of antibody that happens to be called IgG. We don't need to know the details, but that one really suggests that you've had your body's had a chance to make some of the more long-term immunity, if you will, or antibody response, and that you have at least, we believe, some level of protection against that COVID-19, against that strain. And so where you think about this, in an absolute best case scenario, to get back to the question, if you had COVID-19, we definitely think that there is some level of immunity or protection that comes after you've had COVID-19, where you've had, assuming that you've had this immune response, your body then can recognize it. This is what a vaccine eventually will be able to do, to more for sure give you that antibody response, give you that protection that your own body will make. And so, but what we don't fully know is whether it's a total protection against COVID or a partial protection, and we don't know how long it lasts. So say you've had this good immune response, it's good short term, it's probably good for months. Is it good for a year? Is it good for longer? How long it lasts is a major question. And
we just haven't been in this
We just haven't been in this long enough. We've only been at coronavirus. I mean, it's only existed in the world still for a few months. And so there's a lot of questions still about how this immunity will play in. But it's really important. And some of the conversations that we've been having as we think about sort of what comes next, right? Like as we start to think down the line about coming out of some of this shelter in place and what does that look like and how do you continue to protect folks, you actually imagine scenarios as the testing for antibodies gets better. Again, it's not even approved by the FDA yet, but as it's getting better, and again, tons of researchers working on it, you could imagine settings where you're very frequently testing healthcare workers, for example, first responders, and looking for those antibody responses, and you would then feel much more comfortable with people who have recovered from coronavirus coronavirus being on that front line, right? Being out, taking care of patients in these riskier settings, because overall their risk would be much lower. Now, would it be zero? We don't know yet. And that's why there's still, recommendations around wearing the personal protective equipment, for example, and not just assuming that where you've had exposure, you're completely protected. We'll be learning more about that. Certainly, it's some of the most important research happening, but it's really good news that as people recover from coronavirus, they have at least some degree of protection. And so, could you get it again? There are still questions about that, but you would have certainly some good protection against potentially getting it again. Maybe we could talk about, if you think about flu vaccine, right? Like that's sort of a good analogy in some ways, because the flu vaccine, it is absolutely safe, which this vaccine will be too. You have to be able to say with certainty that when I give you this vaccine, I'm not going to make you sick. The flu vaccine does not cause someone to get flu. The COVID vaccine will not cause someone to get COVID. But the flu vaccine is actually not 100% protective against flu. Some of this is because there's different strains and we have to create a new one every year. But what it does do is really decrease significantly. First of all, it does have protection, and so there are many fewer cases you'll see, and especially people who would have more serious. It really helps protect people from getting hospitalized. It really helps protect people from dying. And so that's where we think about, in an ideal world, we'll have a vaccine like the measles vaccine. Like the measles vaccine, but we've had like 50 years to develop that one, is, it's not only is it fully safe, but if people get the 2 doses, it's almost universally protective.
You don't see measles.
You don't see measles, you don't have to worry about it. Nobody knows yet for sure how completely good even this vaccine will be. But where you think at a population level, it's huge to be able to have protection that even if it's not 100%, it's really good news to know that we'll have over time people who have recovered and have at least some degree and potentially a high degree of immunity to COVID.
Right, and a vaccine for those, especially who have underlying conditions.
That's right. The vaccine is going to be huge. But these questions about why is the vaccine taking so long, some of that is about you need to make sure not only that it's safe, but that it's effective over time. We can't run a vaccine campaign and have people protected for a month, right? That is not effective for anybody. You need to have some understanding of how long protection lasts. And so a study of a vaccine has to go for a year, probably, you know what I mean, to even have a good sense of whether it's a good candidate. There are a lot of different studies for different types of vaccines. They'll be looking to see which are obviously safe, but then also which are effective. And then we'll be using that to really help protect probably vulnerable populations first, and then sort of going on from there.
All right. This is a related question, so I'm just going to ask it now. Jocelyn Portuando, how soon will Chicago get these antibody tests?
Yeah, so again, we are starting to see them in use, but they're not approved for clinical diagnosis yet. We're using them more in conjunction. That's the best way to be using them, in conjunction with that more nasal PCR test. So I can tell you, for example, the Chicago Department of Public Health, a lot of our focus, obviously we're focused on protecting everybody in Chicago, but we have a lot of extra focus on settings where people are living, a lot of people live together. So long-term care facilities, or shelters, homeless shelters, for example, settings where there are a lot of people, because those can be high risk, right? It's harder to maintain that social distancing. A lot of common areas. There may be a lot of people with underlying vulnerable conditions. So like if we talk about what some of the work that's been happening, not just from the health department, but from many other departments and partners, we worked really fast to make sure first that in our shelter system, we opened up a lot of other spaces, worked with, the Y was a great partner on this to make sure we could have that social distancing. But then we've already been quarantining some high-risk individuals from the homeless shelters. People who are in that older age group, people who have underlying conditions, have pulled them out of that shelter setting setting, to have them be in hotels, for example, like really in like a true quarantine, somebody who is not sick, but may have had some exposure, and you want to really protect them. But then also we've been working again with many, many partners. So maybe we'll talk next week in some more detail, because I do want people to understand this. It's interesting and important. And the sign of how a lot of different organizations are pitching in Chicago. But we've been working to, if anybody develops symptoms, for example, in these shelters, to obviously remove them from the general population, get them again into a more isolated setting, get that testing done, and then if someone is positive, have them be recovering in one space. If they're negative, they can kind of be back in the shelter space. But we at CDPH, we've just added a little bit of that antibody testing. We're sort of trying it ourselves, but only in conjunction with the PCR, with the nose one, because that's the one that is truly sort of in place for clinical diagnosis. We want to have good understandings of how these tests, as they develop, really function in the world, because it's such an important thing. I think we will eventually have very widespread antibody testing. I think we're going to need it. It's how we're going to understand, sort of as a city and as a country and as a world, where we are in terms of coronavirus. We'll be using it probably around shelter in place, but it's just still early. So it's coming really soon. I think we'll see FDA announcements probably in the matter of a few weeks, I would guess, maybe even shorter. But then it's about getting, as the tests sort of are approved, they still will have caveats around them, I'm sure. And they're really best used for that population surveillance. So we're excited about them. We're excited, obviously, to start being able to use them, but you have to pair them with the ones that are approved to make sure you're not giving people false negatives and false positives and people making all kinds of assumptions. So it's just one piece of the testing, but one of the ones that we're paying the most attention to, obviously.
Okay. A lot of questions about testing today.
Yeah.
Denise Lopez-Gill from Facebook. What are they going to do about the fact that a lot of people may have already had COVID-19 in January or February, but didn't get tested?
Yeah, exactly. Perfect. So this is where, we're in the middle of putting together some technology that's going to help us support some of the more traditional public health testing and contact tracing and investigation. So there will be an opportunity for individual Chicagoans to put in some information and sort of report in that I was sick at this time. I had a test, I didn't have a test. It'll be a real time where if you're having symptoms, we'll be able to give you some guidance about what you should do and how long you should stay home, link people to testing. We're going to use it as some pre-vaccination registration. So there's going to be this sort of platform that's coming hopefully in the next week or two. We'll let you know for sure when it's live. It's a big project for us. But the bottom line is that if you think you've had coronavirus and you've recovered, this is where that antibody testing is actually going to be important, because that's going to let us know whether you actually had COVID, right? And whether you've had that immune response. And so, we've even been thinking about, as a whole city, we're potentially having people sort of report in through ways that are not burdensome and protect privacy and everything. Might we then think about how you would match antibody testing and make testing available for those individuals? So lots coming, but I think, we know that there are plenty of people who have had coronavirus and don't show up in those numbers. We account for that as we're taking into account what our curves looks like. It's part of why we look the most closely, although we look at what our curve is doing overall. We watch really closely what our numbers are doing in terms of hospitalizations and ICU, even deaths, because in those cases people are tested, right? Like if you're sick enough to be in the hospital, you're sick enough to be in the ICU, absolutely people are getting tested, because it's different, in terms of us both understanding. And you may, for example, get enrolled in some of the experimental treatments, or there's just, it's important to know in a hospital setting. And so we've seen some of that beginning of curve flattening, not just in the general population where we know we're missing people, but in some of those people who are sickest as well. So that's part of what lets us know. And we make estimates, again, that there are people we know that there are people who have been recovered. We know there are people who have been asymptomatic, right? And have not even been counted. But as more of this wide-scale testing really becomes approved, first approved, secondly improved in terms of fewer of these false positives and negatives, accuracy, when you can start using it for clinical diagnosis, and then really thinking, I think, as a whole society, how we're using that. So it'll be individual level, it'll be probably some large scale of this surveillance. So. Yeah, so if you were infected back in January or February, and you're doing better now, great. I want you to keep staying at home. I want you to keep, doing all of the things. You don't know for sure, and even if you were, we don't know that immunity would be complete. We don't know how long it would last. So I don't want people thinking, oh, just because I've recovered, I don't have to do any of this. Absolutely not. We need everybody sticking with us, doing the stay at home, especially in April, just being so serious about it. But these are some of the big questions. We'll be understanding it as the months come.
Okay, question from somebody who has been serious about it. Flores Aviles Amor from Facebook. I've been at home safe,
good,
but I have to go shopping and I'm afraid of getting contagious. What is the proper way to go safely into a grocery store?
Okay, good. So obviously I don't know you or your underlying situation. I'd say, first of all, if you've been home this whole time, well done to you, and really thank you for staying home. If the reason you've been really home is because you're older or you have some of those underlying conditions, if there is a way for you to have food brought to you or groceries brought to you, there's the ability to order online, but there are also other organizations. You can go on the website and find out more in case you're needing some support with food. If you don't have anybody who's able to bring your groceries, or you're not able to think about that, the ways that we've really been talking about staying safe when you go out would apply the same for going to the store. So first of all, you want to make sure that, all throughout when you go out, we're thinking about keeping social distancing. So at least 6 feet away from each other. Okay, so be thinking about that. And be thinking a lot about hand washing. So, if you're in that older group, for example, I know that a number of the stores, it's available on our website.
Separate hours.
They have separate hours for people who are older or have underlying conditions. That's mostly about making sure that there are fewer people in the store, that you're having good social distancing. So you could use those hours if you fall into that category. And then you're just going to want to be really conscious of things as you touch them. Do wear a cloth face covering. You can just cover your mouth with a scarf if that's what you've got at home. Again, that's more about in case you yourself were infected and didn't know it because you had symptoms. You want to help keep some of those germs in a little bit. Away from everybody else. But then you go to the grocery store like you would normally go to the grocery store. And you go into the grocery store and you do your shopping. You want to be really careful about not touching your eyes, your nose, your mouth. If that scarf is on there, for some people that can serve as sort of a reminder of that, especially over the nose and the mouth. And then a lot of the grocery stores, do have things in place. They're limiting how many people are in the store. They're keeping that social distancing. They're marking spaces. But there's nothing magic to this. It's just keeping distance from the other people as much as you can. If you accidentally get within 6 feet of somebody, don't worry about it, right? Really, the risk comes especially for close contact where you're at least sort of 10 minutes. That's what we think about in terms of that within the risk. But keep your distance as much as you can. And then really make sure, that you're doing a good job of hand washing. The grocery stores, they're doing a lot of wiping down of carts, which is good. Yes. They're doing a lot of, just trying to have extra cleanliness. But remember, we talked about this yesterday, even if somebody had the main way that this spreads is not through the touching and the picking up, but even, say you're, I don't know, buying oranges and somebody just sneezed onto the oranges, those germs do not jump from the oranges into your eyes, your nose, your mouth, right? Like if you are touching things, they come in through your fingers. And so good hand washing before you touch your eyes, your nose, your mouth. And then, as you get home, very good hand washing there. And then you've got the food that you need.
Yeah. My daughter this week, when I come home, she's like, "Did you wash your hands?"
Yeah, exactly.
So it's just a good thing that when you've been out, as soon as you come in, to do that. Right?
Yeah. So see, if you haven't been out, good job. See if someone can bring them to you, because there may have been an underlying reason. But otherwise, we know people have to go out for essentials, and my goal is not to scare you from having to go out if you need to go out. The same things that we've been talking about every day are the same things that will help keep you safe. So.
Okay, Cynthia Regina from Facebook. Do elderly people who have had the pneumonia vaccine experience less severe symptoms if they have COVID-19?
Okay.
Any protection from having that vaccine?
Yeah. So we've talked a little bit about this before, but because COVID-19 is a brand new disease, we don't have a vaccine against it. So I'm glad to hear that you got your pneumonia vaccine. That pneumonia vaccine helps protect you against some of the strains of bacteria that cause especially older people and people with underlying conditions to get some bacterial pneumonias not caused by a virus, but caused by bacteria. So the pneumonia vaccine itself does not protect you against COVID, just like the flu vaccine itself does not protect you against COVID. But being up to date with your vaccines does mean that if you were infected with COVID, you are protected against those other, it's much worse if somebody has COVID and influenza. It's much worse if someone has COVID and one of the bacterial pneumonias. And so one of the reasons why, always people should be up to date with their vaccines is that it really does help protect you from these other things. So I'm glad you got your vaccine. Again, that goes into the realm of being the healthiest that you can be right now. Keeping track of, your chronic conditions. We talked a lot about that yesterday. Taking your meds, taking care of yourself, but there's no specific protection against COVID that would offer.
Okay. Eve Becker from Facebook. We are supposed to wear a mask in public. Are we supposed to wear a mask when walking outside or exercising outside, or just when we're going to a store, etc.?
Yeah, so the specific guidance around the cloth face coverings is for settings where it's hard to maintain 6 feet of social distancing. So definitely you should wear them if you're going into a store, if you're going into a pharmacy, these inside spaces, especially if there might be a difference of the 6 feet. I think if you're able to have it on when you're out and about, there's sort of no harm to it. Do you know what I mean?
Yeah,
I think
it doesn't hurt.
Again, it's more about your germs not getting out as much as it is about things coming into you. If you're out by yourself, right? Like it is safe. We say this almost every day, but I think it's worth saying again.
Yeah.
It is safe for you to be outside by yourself or with people in your household. It's good for you, in fact, right? To be getting outside, not big, long not going where people are gathering, not getting together in groups to exercise, but to be going out. No play dates, but going for a walk, being in your yard, being on your porch. It's good for your mental health. Getting some exercise every day, getting your heart rate up every day, good for your mental health, good for your physical health. Helps keep your heart and your lungs strong. Right? This is good, and I want people getting some exercise either in home or close to home. If you don't interact with anybody outside, there's not any concern. And if you're in a setting where you're not likely to interact with anybody, there's not a concern. If you want to put a mask on or a face covering on, especially if you're going to potentially be around other people, I think it can help. But it's less important than the social distancing, the hand washing, all of these other things. So my concern about the face coverings is that people will be like, oh, I have a mask on.
Yeah,
now I'm good. I get closer to people. I don't have to take those other things into consideration, and it's just one piece, and it's not the most important piece in terms of protection. So I'd say, depending on what kind of exercise you're doing, I think people often have trouble with, having that covering. So it's more about being away from where others are. But if the weather is nice this weekend, I want people opening windows. Good ventilation inside is also good. It helps just kind of have good air, have good air currents. Circulation. All of that is a good thing. I don't want people thinking like the air outside is in some way a bad thing. It's better, if you have multiple people in the home, it's good to be getting some of that air circulation in. It's perfectly safe to be outside by yourself. And the face coverings are designed especially if there's any concern that you might not be able to maintain that social distancing. So wear it, wear it when you're out. But like here, we're sitting right here. I'm not wearing a face covering because we're keeping our social distancing. I don't have concerns about that. Where I'm in a setting, like yesterday, I was out and I was down at McCormick Place, and there's a lot of people and a lot of movement and moving in between. I wear a mask in that setting.
Yes, yeah. I think it's so important to answer these questions, even if they're being answered over and over again, because
we don't mind.
The guidance has evolved.
Yep.
And so people just really want to understand.
That face covering piece was really, as some of we talked about, as some of the science was coming out, showing that in these settings, like that cruise ship, like that long-term care facility, where there weren't other reasons why people would have gotten coronavirus, finding a good percentage, 13%, 18% of people just didn't have symptoms, or at the time they were tested didn't have symptoms yet. And in that setting, even if somebody's being totally responsible and absolutely staying home if they feel a little bit sick, there's some risk that they could be asymptomatic and potentially spreading coronavirus. So that face covering is a part of what we do to help protect against the spread. But even where there's been studies of face coverings and masks for other diseases, they work with hand washing, with social distancing. They are not a panacea.
It's a combination.
Yes, it's a combination.
Okay. Well, I know you had some tips to share, especially since this is a very special weekend.
Yes, it is.
For people of certain faiths.
It is. So again, I think both Passover and Easter are stories about resilience and rebirth and regrowth, and I think they're a time that really offer some hope to people, even at the same time that they are a sign of all the things we would normally be doing. I read this interesting article by what was her name, Leah Corder, Corder, that was talking about just why am I so tired. It was one of these online things, and just talking about how in the time of coronavirus, first of all, everybody, all communities are sort of having some of this community level trauma, right? Where we talk about everybody being in this fight or flight response, right? Your amygdala, there's this little part in your brain that is designed when you feel a threat to like bring your heart rate up and bring your breathing up and adrenaline and stress your body, and that's good when you're trying to get away from something, and but when you're constantly having this feeling of an ongoing perceived threat, and you keep getting sort of re-traumatized. This is the language that we use, where every time, every day you're hearing us talk about increasing cases and deaths, and you're reading these studies and you're trying to think about how does this impact me, and you're seeing some of these really terrible stories in New York where there's not enough healthcare. Each of those at some level is like telling your brain we're in fight or flight, right? And it's very hard to calm from that. And then especially uncertainty, right, is one of the most stressful conditions for people. Like there's some interesting research that's been done that shows like when women are awaiting a biopsy result from like a lump for potential breast cancer, their stress hormones are actually higher during the time they're waiting for that result than when they've had that result, even if it turns out to be breast cancer, because at that point you can sort of make a plan, you can have hope. But this uncertainty is a particular type of stress, and there's so much uncertainty about this right now, right? It's about like, how long will this last? Is this little tickle in my throat the beginning of coronavirus? Like, what is this going to look like? It's a major time of uncertainty for people. And it's a major time of grief for people. We think a lot about the families who have, had cases or have had deaths. But for everybody, at a low level, we're not getting together for Easter, right? We're not celebrating graduations and weddings and funerals. We have lost so much. And all of this has happened really just in the space of like a few weeks. And you think about how communities sort of respond to, war or you think about a tornado. I mean, these really massive community-wide effects. And this one at this point is very much sort of ongoing with all of that uncertainty. And so recognizing that like this trauma that everybody just is feeling, this uncertainty, some of this grief at every level does bring just much more emotions with it, right? Like, and it's very normal for people to be feeling, you know, I was reading the other day that like, you know, all of the comfort food sales are up, right? Like people aren't buying kale as much. They're buying like macaroni and cheese and like the you know, the things they associate with comfort. Yes. And that's normal, right? That's like you looking for any place to sort of get comfort. But, you know, things that you can do to just like take care of yourself, have compassion for yourself and for everybody else. Like it's just a very heightened emotional time, a lot of anxiety, a lot of worry. It's not a surprise that people are probably having trouble feeling productive, right? And like, am I doing all the things I could be doing? And, you know, I've got all this time now potentially if you're home, but like, it's still, I can't, you know, always do it. And that's really normal. And I think it's important for people to have some of that self-compassion, all the things that you can do to take care of yourself, whether that's taking a nap, taking a walk, calling a friend, not calling a friend, right? Like, like there's this need for connection, but then also there can be times where you just feel about it. And there can be a lot of guilt, I think, too. You know, it's one of my jobs to stay sort of calm. I'm lucky in that I have some of the medical training that helps me sort of sort through some of this uncertainty, and I can know a little bit more, I think, than maybe somebody who doesn't have as much of the training, like which of these things I really need to worry about versus which I don't. But I recognize that not everybody sort of has that training, has as much access to the data, has the opportunity to think about this. And so, you know, one of the reasons we really do this is to try to give you the information in a way that's not meant to scare. It's meant to really let you know what we know, to take out as much of that uncertainty as we can, recognizing there's a lot of questions we just don't have answers for. I love it when I hear from people. We occasionally, me and the health department, you know, do sometimes get these really nice letters and notes from people really thanking us. I get a lot more letters of people who are, you know, upset or anxious. And I get it, right? Everybody's worried right now. But I think trying to have some compassion for yourself, as you do for everybody who you are in contact with. Like, at a time where everybody's in fight or flight, like patience is low, right? Worry is high. And I think just, you know, going into sort of this Passover and Easter season, thinking about where you can have some hope even in the time of uncertainty. Even in this article, they talked about having sort of grace and kind of what does that look like. So
I think what's really challenging for a lot of people too is that for many of us, we cope by connecting.
Yes, exactly.
And this sense of community and belongingness.
Exactly.
And as I think about this weekend, and people from my family who normally would be going to church for Easter,
right?
And being able to connect with others like in person and physically, it is really hard.
It is.
And it's hard to imagine or to believe that a gathering like that could actually be deadly.
Yeah.
So I know that I'm talking to my mother more frequently than I usually do, reaching out and connecting, either through FaceTime or through the phone.
Yeah.
I also know that this Sunday there'll be a lot of services online, so that people can connect. And kind of, it's not the same feeling as you would have if you were to come together, but just reminding people that people are really stepping up and making some of these traditions that we're used to available virtually, so that there can still be that sense of connection, and so that we can be empowered by that connection, if that's where we usually turn to. To really feel relief and to feel comfort, and to cope with loss and trauma. Yeah,
it's so important. So we've got a short list here. First of all, related to Passover, the Seder is this feast. You know, during normal times, I've loved being able to gather with Jewish friends around it. And as Passover continues, there are traditions that go along with this. JewishLive.org is created by Dan Liebenson of Hyde Park, and there's all kinds of resources in there about live and recorded seders and services. There's apparently a part about making homemade matzah, all sorts of good things if that is your tradition. Related to Easter tomorrow, so ABC7Chicago.com as well as their TV station will be streaming Easter Mass in English at noon. Univision will be televising Easter Mass in Spanish at 10 a.m. Polavision will be televising Easter Mass in Polish at 10 a.m. and 3 p.m. On the radio, WGN 720 will be broadcasting the Holy Saturday Easter Vigil from Holy Name Cathedral at 10 p.m. tonight. And then the Easter Sunday Mass with Cardinal Blaise Kupich from Holy Name Cathedral at 9 a.m. Sunday. That's for folks who may be Catholic. And then the live stream of the Vatican, actually, with Pope Francis is going to be live streamed on YouTube, recorded for later time. And then, obviously, so many of the congregations around Chicago are doing their own broadcasting. I really encourage you to look for one if Easter is something that you celebrate. See what your own congregation may be doing, or go ahead and look for some of these, or visit another. You can, at this point they're all getting recorded. You can shop around. You can really see some of the different Easter services, as so many of our congregations here are really thinking about how to differently celebrate this. And then if you don't celebrate Easter or Passover, there's a lot of actually really nice concerts and things that are up around the world, free. They're being done without concerts, but I encourage you to just do some looking for, as always, sort of some uplifting things. But especially this weekend, I'm sorry that people aren't going to be able to get together in person, but it's so important to stay home and save lives, and just think ahead to next Easter, where we'll, by this point presumably have vaccines, just be in a really different place. And it's a lot, but be kind to yourself at this time.
All right. We will be back on Monday.
Yes, we're taking Sunday off.
Back on Monday at 11?
Yes.
Okay. And we look forward to seeing you then. Stay home
and save lives.